ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome. My name is Nicholas and I'm your host for today's ECDC On Air podcast, the podcast of the European Centre for Disease Prevention and Control, which is recorded from our headquarters in Stockholm, Sweden. This episode will touch upon topics such as vaccine hesitancy, the spread of health misinformation, and how public health authorities can best deal with all this. With me today, I have John Kinsman, who works at ECDC as an expert on social and behavioural change. Hello, John. Nice to have you here. Can you tell us about yourself and what's your background? What do you do at ECDC?
Thanks, and thank you very much for the invitation to join here. As you say, I'm working on social and behaviour change here at ECDC. I've been here since April of 2019. Before that, I was working as an associate professor in global health in Umeå University in the north of Sweden. And I worked on various infectious disease issues, AIDS, Ebola, Zika, and so on. And also I did some work as a contractor for ECDC before then. So since I've been with ECDC, obviously most of the time has been the pandemic, and obviously my work has been very, very focused on that, to do with risk communication, to do with online vaccine misinformation, and also supporting socially vulnerable populations during the lockdowns and facilitating vaccination and things like that. So it's been very varied and a very rich experience to have the opportunity to work here.
It's interesting to see here because your role at ECDC, I see it as quite special. Most experts here at the centre, they come from more like an epidemiological or biochemistry background, whereas you come from the behavioural science field. What place would you say that behavioural science has in disease epidemiology?
Yeah, it's a really interesting question. I think if you look back to the start of the pandemic, we had a lot of questions about the virus itself. What is this thing? What are its characteristics? How is it transmitted? What are the clinical manifestations? How many people die from it, and so on? So there were all these questions that made everybody very, very anxious about the virus itself. But as we've gone through the pandemic, we've realized more and more that it's actually controlling the virus is about people's behavior, because it's people's behavior that spreads it. So unless we really understand that and we support safe behaviors, the whole thing is just going to continue. I think there's an example I'd like to give on this, which we look back to the Ebola outbreak in West Africa. In the beginning of that outbreak, there were a lot of people were being buried, unsafe burials, and they had a very important sort of cultural tradition within many of these communities whereby people had to be buried in a very particular way. Otherwise, the spirit wasn't properly released. When the public health people were saying, you can't bury people like this, the local people were saying, well, we have to bury people like this because otherwise the spirit will not be properly released. And so it became a sort of negotiation between the community and the public health officials. And the public health officials had to understand the behavior and why people did it the way they did it. And so they came about with some compromises that helped to do the burials in a way that was traditionally, culturally acceptable, but also medically safe. So essentially what we're talking about here, and this applies also in the pandemic, we need to listen to the community. We need to show respect for people's opinions, even if we don't agree with them. And this can be to do with masks or vaccines or whatever it may be. We need to understand what's driving people's behavior. The technical solutions are there, but we need human beings to implement them. And so that's really where human behavior comes in, I'd say.
You work with this, and I'd like to hear more from you about the reasons why some people are skeptical to getting vaccinated. But maybe, first of all, could you maybe just define vaccine hesitancy?
Yeah, it's a widely used term, and I think it's important that we give it a clear definition. And the WHO, the World Health Organization's SAGE working group on vaccine hesitancy has come up with, I think, what is probably the best way to look at this. They talk about the 3 C's. Complacency, which is whereby people think, I don't actually have a risk from this disease, perceived low risk. Confidence, which really is to do with trust in the vaccine itself and in the authorities or the government that's providing the vaccine. And also convenience, which really has to do with access. So looking at these 3 C's, you can kind of look at different aspects of people's different behavior and understand what's driving them to be hesitant one way or another to take the vaccine. We talk very often about vaccine hesitant people as people who need to be persuaded or something like this. And it's very important to realize that people have legitimate questions about vaccines. The COVID vaccines have been developed faster than pretty well any other vaccine ever. including with new technologies and so on. And so people have reasonable and legitimate questions that we need to answer and listen to. And so when we're talking about vaccine hesitant people, it's important not to sort of label them as, quote, anti-vaxxers or something like that. There are lots of reasons why people would hesitate one way or another to be vaccinated, and we need to understand what those reasons are and meet them. And I think we can say there's a pretty clear relationship between misinformation and vaccine hesitancy. That's specifically looking at undermining confidence in the vaccines. But vaccine hesitancy isn't always the result of misinformation. You've got a lot of other explanations. Probably the biggest one would be trust in the authorities. And I think we can also touch upon this in our discussion about different groups of people who feel more vaccine hesitant than others, who have less confidence, less trust. You have to ask yourself, why would people necessarily believe that a government that you distrust or that you think has nothing to give you is then going to go and turn around and give you something that is actually good for you, a vaccine to prevent COVID? So essentially what we're talking about here is the contract between state and the population. And if the population perceives that that contract is not in their favor, then the trust is not there and they may not want to actually believe in the vaccine that's being offered by the state. So that exists in many countries in the world. You also have, I think quite a lot of these things are linked, ideologies. There are some people who have religious beliefs or spiritual beliefs that, getting sick is part of God's plan. There are certain groups, the anthroposophists or the people who support the work of Rudolf Steiner, who believe that a child's fever actually facilitates the incarnation of their spirit, and through that actually the fulfillment of their karma. So this is a really deeply felt belief that people have. And you can't then just expect that whole principle of the need for a child to have a fever to disappear when you say, well, we're offering you something that will make sure that child doesn't have a fever, if that fever is an important part of their spiritual development. So there are issues like that. Libertarians also have an ideology, government shouldn't tell me what to do and so on. So that there's that element. So we've got trust, we've got ideology. I think also there's a degree of sort of fantasy thinking in which, whether it's COVID-19 or climate change or something like that, are seen as hoaxes. Because people ultimately don't really want to challenge the way they're living their lives. They want to tell themselves positive stories that everything's going to be fine. And so part of this is probably a kind of rationalization, quite a complex rationalization to convince myself that I can continue safely as I always have been, without having to change too much. So these things can kind of combine one way or another and bring about vaccine hesitancy in people's minds.
That's really interesting. I just want to go back to one thing you said there about the distrust in institutions. Do you think that there is more of a general distrust in institutions in our society today compared to before? And in that case, is that something then that is a threat to public health, you would say?
Yeah, I mean, I think we've seen in a lot of countries there's been an increasing polarization over the last few years, and that's symptomatic of all sorts of socioeconomic disruptions that have taken place. So I think there is clearly growing mistrust between population and state, or as I talked about, the contract between the population and the state is seen in many people's minds as being undermined. But there are also examples, and one really, really good example of where this simply hasn't happened is New Zealand. And in fact, amazingly, over the course of the pandemic, the New Zealand government has actually had the people's trust in them grow. And that's largely because the Prime Minister, Jacinda Ardern, has taken on a very, very all-inclusive approach to this. It really is working on, going back again to this idea of the contract, that it really is the state is serving the people. And she has talked about the team of 5 million, the 5 million people living in New Zealand, as a group of people who are working together with the government to solve this problem. And so through that fantastic approach that she's had, they've actually been able to build trust. So even though in many countries trust has reduced, it is possible with the right leadership to actually increase trust and make things work better.
Would you say vaccine hesitancy is a new thing that's come with social media, or has it existed before?
No, it's been around since the very first vaccine, actually. I mean, social media is simply a new and very efficient way to promote people to lack the confidence in the vaccines. But vaccine hesitancy really goes all the way back to the beginnings when Jenner created a vaccination against smallpox already in 1796. There were caricatures of people sort of sprouting cow-like appendages because he was using a cowpox inoculation to bring about the immune response that would prevent smallpox. So already in 1800, there was anti-vaccination. There was the Anti-Vaccination League formed in the mid-1800s in the UK. So this has been going on a long time. And then, of course, we had the scandal in 1998 when Andrew Wakefield incorrectly and erroneously linked the MMR vaccine with autism. That also created a lot of vaccine hesitancy. That was prior to social media. And then after 9/11, unfortunately, there was something of a resurgent view in some Muslim countries that the polio vaccine was causing infertility. So this caused problems in polio vaccination programs in Pakistan and Afghanistan and Nigeria. So this was not something that was necessarily on the back of social media. This was something else. Social media has simply facilitated the spread of vaccine hesitancy, but it definitely has not been the cause of it.
Do you find that people are more hesitant when it comes to vaccines compared to other forms of medicine and medical interventions? And if so, why would that be?
If you think about what a vaccine involves, you're putting a needle into your body. And from a sort of evolutionary perspective, that's not a normal thing to do compared to, say, swallowing a pill or a medicine. You swallow something, that's what we do many times a day. You don't normally stick needles into yourself. So already you're dealing with something which is against what we naturally want to do. And there's inevitably, therefore, going to be some degree of sort of emotional resistance. And I think it's fair to say that all medical interventions have some risks attached, but those associated with vaccines are more emotional, more emotive than many others. I think there's a tendency that we have to rationalize things that we don't like and rationalize them away so that we actually say, I don't want to do this, I shouldn't be doing this, even if it's actually the right thing to be doing from a public health point of view. This reminds me of my experiences in Uganda when I was working on HIV prevention, behavioural HIV prevention there. And condom use was, of course, something that we were promoting. And I had so many discussions with people who would say, but condoms are not 100% effective, and so why should I use it? And so, the response would be, well, they're pretty effective, 97% effective or so against the virus, and they're also protective against pregnancy and other sexually transmitted infections. So isn't that quite a good thing? But they're not 100% effective. So people would, I had this discussion so many times, I realized my interpretation of this was people were justifying to themselves something which they didn't want to do. People don't really particularly like using condoms. And so they could therefore rationalize their way out of it by saying it's no point in doing it. And I think there may be a similar thing with vaccines. People don't particularly want to do them. And so they'll pick on something which justifies that they don't want to do it anyway. So this is, I think, part of the reason why people are hesitant. And again, linked to this, I think we have essentially the sort of public health paradox, whereby if we do something in public health that works, you're making something bad not happen. So life just goes on. Whereas if you're, say, a doctor who's treating a disease, you're taking away the problem, taking away something that was bad. So the experience of that is that bad thing has gone. Whereas with the public health approach, the vaccine, for example, the bad thing never happened. And so therefore this can kind of lead to a degree of complacency. And people may say, well, the vaccine, it's not really a problem anyway, so why should I be doing it? And in that sense, vaccines can become a victim of their own success. You talk to somebody under the age of 40 in Europe, and they've probably never encountered polio. But if you ask your parents or your grandparents or your aunts or your uncles, they will know about polio when they were a child and the fear that disease brought. So the vaccines brought about the end of that disease, predominantly in Europe anyway, which leads to complacency, which leads to, well, why should I bother? So I think all these things come in together. And if you're looking at something, to go back to the first point I made there about the needle, if you're looking for a justification not to stick a needle into yourself, then that might be good enough.
That's really interesting. What are the reasons why people and organizations spread health misinformation, do you think?
I think we need to think about what are we talking about with health misinformation. The European Commission defines it as something which is verifiably false or misleading that may cause public harm. That is misinformation, but there's a critical difference between misinformation and disinformation. Disinformation is something that has been actually created and disseminated for the purposes of deception or for economic gain. So we have a distinction there, and even though the product may be the same, the fact that this misinformation, that the information is not correct, the intention behind that is different. So people can disseminate disinformation for the purpose of selling products. They can say, well, I've got the solution for this disease, drink this, eat this, buy my book, whatever it may be, there's money in it. We've also got political reasons for it. The different governments want to sow confusion, discord in the other countries that they don't like as a deliberate policy. So that's something which is extremely problematic, obviously, and needs to be countered. But in terms of misinformation, which is just the false, misleading information, this is often spread by people who genuinely believe it. And they think maybe that they're helping their friends, maybe they're helping their family, maybe they really do believe there's a conspiracy. And of course, we've had the discussion earlier about social media and the echo chambers that people get themselves into. You find yourself only hearing a certain perspective, and so therefore it becomes deeply embedded in you. Therefore, you become convinced that this is what's going on. And there are activists in the UK who are trying to sort of establish elements of a parallel culture as an alternative to vaccinated society. They consider themselves to be, quote, awake, and that they're not really being included in society because they're not having the vaccine. So these people are subjected to misinformation in the sense that they think that the vaccine is not good for them. And as a result, they're refusing it and they're creating a whole new lifestyle to go with that. So there are many, many reasons why it can happen.
John, can you tell us a bit more about which institutions that people trust the most when it comes to health information?
Yeah, the surveys have been done on this, and always at the top of the list, it's health workers. They're the most trusted source of health information. They're the people you're looking at. You look them in the eye, and they're saying, now's the moment for you to be vaccinated, or I'd like to do this to help you or your child or whatever it may be. So surveys consistently show that health workers are at the top of the list of the most trusted sources. So they clearly have a major role to play in promoting vaccines. And part of that is to do with skills that most healthcare workers already have, which is listening and empathy. That's largely why they're in it in the first place, in that role. So they have a big role. And of course, then on the flip side of that, if they are hesitant themselves towards vaccines, then this can be very damaging. And there are actually, there's a surprising proportion, a minority definitely, but there are health workers who are vaccine hesitant themselves, and they can encourage their patients not to be vaccinated. So that's an issue that we also need to be dealing with. In terms of trust in the national authorities, I think that depends largely on local context, political context. Again, to do with whether or not the contract between people and government is being respected and whether that's strong. Health authorities themselves are often seen as somewhat removed from the government, so they may be trusted more than the government, but again, that will largely depend on context. And I do want to say one other group of people we can think about. These are not institutions, but these are cultural or sporting heroes, you could say, who are people who can very often be very influential in promoting vaccinations. Going back to the West African Ebola outbreak, in the beginning of the outbreak, there were a lot of people there who said Ebola is just not true. It's the government's lying, that they're doing this just to make money and so on. And being a very, very passionate footballing nation in Sierra Leone, they actually brought in posters of, who would you believe, Cristiano Ronaldo, standing there with the football in a stadium saying, with a written by him saying, Ebola is real, just that. And that was one of the clever ways of actually making people wake up to this problem, because he personally had no stake in this. No one was suggesting that Ronaldo was making money from Ebola. But if he was saying Ebola's real, then it was going to plant a seed in people's minds. It's like, oh, well, maybe it is. And you could say there are also examples now in the sporting world of some sporting people who are opposed to vaccines. Equally, there are some people who have been sportsmen and sportswomen who have been sick from COVID. An example quite recently is actually the goalkeeper from Newcastle United, Carl Darlow, who was extremely ill. He was in hospital just a couple of months ago with COVID. And he has been speaking about it, and he's been trying to actually say, this is a serious thing. And it's a very potentially powerful way of getting the message across. If someone you like on a daily basis, you have an emotional attachment to you, if you're a Newcastle fan, that's a great thing. There is something you need to be a little bit careful of on this. And again, going back to Ebola, I had a project there when during the Ebola outbreak, we were designing messages and posters and so on for the population to get them to be into treatment and for various prevention measures and so on. And so we made these posters, and some of them were in red and some of them were in green and different colors. And we discovered when we tested them in the community that if they were red, people said, but that's representing the government. And if we put that red poster into an opposition area, then it would be problematic. Similarly, if it was a green poster, that was an opposition color. And if you put it into a government area, then that would be treated with doubt. And so this is a really important point. When you're making these messages, you need to test them and make sure that the message you think you're putting across is the message that's being received. Because there can be all sorts of very unexpected response to things that you never would have thought about unless you test them out. There are ways of developing trust and so on like that.
That leads me a little bit onto the role of ECDC here, because ECDC has issued a number of guidance documents on the topic of vaccine hesitancy. Some examples are on how groups such as health workers can enhance confidence in vaccination. ECDC has also done some literature reviews of how EU member states can motivate hesitant groups in Europe to get vaccinated. And there was also a report in June this year about countering online vaccine misinformation. So it would be interesting to hear from you a little bit more about that report, and also what role do you think that national public health authorities have in correcting health misinformation?
Yeah, this was a report that we did. We did a survey in a handful of member states to try and understand how they understood, the authorities, I should say, how the authorities understood vaccine misinformation within their countries, and also what efforts they were making to address this. And what we found was it was only a small number of countries, so we should be a little bit careful in terms of extrapolating it to everywhere. But we found that the extent to which they prioritize their efforts to counter misinformation isn't necessarily always associated with the actual level of misinformation that's circulating in the country. So there are different priorities that the different countries set for the problem. And we found that clearly there are countries that are doing a fantastic job, but in other countries, they don't really have the resources to address it very well. We've found overall 4 key areas that were needed to be focused on for a country to have an effective strategy. And number 1 really is that you need to monitor what's going on social media. There are tools for monitoring misinformation on social media. You need a real-time understanding of what's going on, because if you don't understand, you'll be, again, going back to the point about testing your messages. If you're not addressing the problem that's actually on the ground as people are experiencing it, then you're going to be barking up the wrong tree. You're going to be providing unhelpful information or unhelpful input into addressing the problem. So you need to understand it through monitoring it, and you need a team of people, ideally, who can do that. You need to be debunking misinformation, which literally means if something comes out that you're observing on your monitoring, which is problematic, which is wrong and misleading people to not be vaccinated or not wear masks or not do physical distancing as necessary, you need to address that. It's a difficult, challenging thing to do because misinformation is very sticky. Very often it's an emotional response that people have to the information. They are emotionally attached to it. So simply presenting a fact to counter that may not necessarily address the problem. So debunking it is important, but very, very difficult. We also need to be looking at what's called preemptive interventions or inoculations. So essentially, when I say inoculation, I mean social inoculation, it's called. We're trying to tell people that there is misinformation out there. Here is what it might look like. You need to be aware of it. So it's rather like an actual vaccine. You're telling the person something's out there, so beware. And then the 4th thing you should be doing is you should be evaluating your intervention. So if you've got efforts going on, strategies going on to correct misinformation, you need to be trying to find out whether or not they're working. And even it can actually happen that your efforts can be, in fact, inadvertently making things worse. So you need to understand whether or not your efforts are effective, if there's anything you need to be doing to improve them, and so that you can actually address these problems more effectively.
Sometimes if you're not an expert, it can be quite difficult to judge whether information is reliable or not. So for our listeners here, John, do you have any tips on how to determine whether the information that you see online is reliable or not?
It's a really, really critical question. We all need to be thinking carefully about what we read online. Probably the first thing to do would be to ask yourself, is this plausible? Is what I'm reading, does this make sense? Is this likely to make sense based on what I know? That's one thing. It's also important to think about who's actually sending this out information. Are you able to see who this person is? Are they a reputable institution, or is it a slightly random group of people who don't necessarily have any accountability to anybody? It's important to think about that. What stake do they have in this? Could they possibly be gaining personally in some way by distributing misinformation? Another thing that we see sometimes is that people who are distributing misinformation use jargon, which essentially is there to mask a lack of expertise. So big words will be put in that don't necessarily coincide with the actual scientific reality of what's going on, but the big words are put in there to make people who don't have scientific training think that they are more expert than they really are. So think about that too. So be aware, be critical, ask questions, and don't take everything you read at face value. I would also say we have ECDC and the European Medicines Agency have put together a very nice website. It's called the European Vaccination Information Portal, and the web address for that is vaccination-info.eu. There's a lot of really, really good information about vaccinations, about the authorization process, about how vaccines are made, and also there are links to all the EU national authorities listed, so you can go to your own country and find out what's your country's position on this and the different vaccine schedules for the different childhood diseases and so on. So ECDC, of course, the website that we have is extremely reliable, the European Medicines Agency, the EMA, and then there's also an organization working through WHO called the Vaccine Safety Net, and they also have a very good network of good vaccination websites that you can rely on. And the last point is also, if you're looking on newspapers or other online materials and you're looking at the comments below, beware, be critical, think carefully about what these people are saying, because very often they're not actually who they say they are. We know very well that there are people who are organizing systematically to undermine the credibility of different vaccination programs and so on. And so when you look at a newspaper or an online article and you look at the comments beneath and you see perhaps a disproportionate number of people who are saying things against the scientific position that's been presented, just think, does this actually make sense? Is there something else going on here? Because what there is doing, and this is very much in the domain of those who are promoting disinformation, deliberately trying to deceive, what they're trying to do is to create in you a mental map that is actually at odds with the scientific consensus. They're trying to put doubts into your minds. And that's something that we need to be aware of. And it's a very unfortunate sort of reality that we live in. The internet is such an incredible tool, but it does also provide the opportunity for people to sow these seeds of doubt and to spread the agenda that they may have, which is not actually in your favor. So be aware, be critical, think carefully, and ask questions.
Okay, thanks very much, John. That was a really interesting discussion, I think. Really hope to hear more from you on other topics in the future. And thank you for coming here.
Thanks a lot. Pleasure.
We hope you enjoyed this insight into ECDC's work. If you would like to know more, please visit us on the web at ecdc.europa.eu or follow us on social media for the latest news.